Welcome friends to Knowledge Park. Today, we move from silence to science. This is the most complete guide you'll find, covering everything from the latest research from around the world to the food on your own plate. Whether you are a woman on this journey, a caring family member, or a healthcare professional, you will leave with knowledge that truly empowers. Menopause is the natural, permanent end of a woman's periods, confirmed after 12 months without menstruation. It usually happens between the ages of 45 and 55. For generations, menopause has been a quiet milestone in a woman's life. But what if we've been seeing it the wrong way? This is not a decline, it's a transition. It's your body's way of telling you it's time to put yourself first. Let's begin with the roadmap. Menopause is a journey, not just a one-time event. Perimenopause is the transition phase. Your ovaries start making hormones in a more unpredictable way, like a roller coaster ride. This can begin in your 40s and may go on for several years. Most symptoms show up during this time. Menopause itself is just one day, when you have not had your periods for 12 months in a row. Postmenopause is the time after that. Your hormones settle at a lower level, and this is a very important period to look after your long-term health. Because estrogen receptors are present all over your body, the symptoms can show up in many ways. Being aware of them is your first step towards taking charge. Mind and mood, the mental side. You may notice brain fog, forgetfulness, anxiety, irritability, or trouble sleeping. Physical. Your body signals, hot flushes, night sweats, weight gain around the tummy, joint and muscle pains, hair thinning, and palpitations. Urogenital, the often unspoken reality. Vaginal dryness, pain during relations, frequent urge to pass urine, and repeated infections. This is called genitourinary syndrome of menopause, or GSM. Long-term silent risks, weakening of bones, osteoporosis, and a higher risk of heart disease. The less talked about issues, itchy skin, a feeling like ants crawling, electric shock sensations, dry eyes, and gum problems. Let's explore the modern medical toolkit for menopause. Today, there are more options and resources than ever before, supporting women through this transition. Research continues to expand our understanding of menopause care. There are ongoing studies and new developments, but it's important to remember that every woman's experience is unique. Always consult a healthcare professional to find out what may be appropriate for you. Some newer therapies are being developed to address symptoms in different ways. These may include non-hormonal options, but their suitability varies. It's essential to seek guidance from a healthcare provider before making any decisions. In some cases, other types of medications may be considered to help manage certain symptoms. The best approach is always individualized and based on professional advice. The most important step is to have open conversations with your healthcare team. They can help you understand your options and support you in making informed choices for your well-being. Medicines are just one part. The real foundation is your daily lifestyle. What you eat, how you move, and how you care for yourself every day. Include protein-rich foods with every meal to keep your muscles strong and your metabolism steady. Think beans, lentils, tofu, fish, eggs, or lean meats. Whatever fits your plate and preferences. Calcium and vitamin D go hand in hand for healthy bones. Enjoy yogurt, cheese, leafy greens, and sunlight. These are great sources found all over the world. Phytoestrogens are nature's gentle hormones. Add a tablespoon of ground flaxseed, soy, or other plant-based foods from different cultures to your daily diet. Omega-3 fats are great for your brain and heart. Walnuts, chia seeds, and fatty fish from different cultures are excellent sources. Fiber is important for your gut health. It feeds your good gut bacteria, the estrobolome, which helps balance hormones and reduce inflammation. Eat whole grains, fruits, and a variety of vegetables from around the world. Sugar, refined flours, and processed foods can cause inflammation, raise your blood sugar, and make hot flushes worse. Too much alcohol or caffeine can disturb your sleep, so try to keep them in check. This is not just a suggestion. It's truly important. Doing weight training or using resistance bands gives your bones the right kind of stress, making them stronger. It also helps build muscle, which keeps your metabolism active. Try to include this in your routine at least 2 to 3 times a week. When you get a hot flash or feel anxious, your nerves can feel all over the place. A simple box breathing technique can help you calm down quickly. Make it a part of your daily practice. Yoga and meditation can be very helpful during menopause. Research shows that gentle yoga, mindfulness, and meditation can reduce hot flashes, improve sleep, ease anxiety, and support emotional well-being. Even a few minutes a day can make a difference. Try gentle stretches, deep breathing, or guided meditation to help your mind and body feel balanced. You are the CEO of your own health, but every CEO needs a strong support team. Here are the experts you should reach out to wherever you are in the world. A gynecologist or menopause specialist, your main guide for hormone therapy and overall care. An endocrinologist, for complicated hormonal issues, PCOS or early menopause, what we call POI. A cardiologist, to check your heart health and get a baseline. A pelvic floor. Physiotherapist, truly a miracle worker for symptoms like urine leakage and intimacy concerns, especially common in GSM. A registered dietitian and a mental health professional, for personalized food plans and emotional support. Go prepared. Keep a symptom diary. In the end, you are your own best advocate. Now, let's take a quick look at what's ahead and clear up some common doubts. Precision medicine. Very soon, genetic testing could help you understand your symptoms better and guide you to the most suitable treatment, tailored just for you. Senolytics. These are medicines being tested to remove old zombie cells from the body, possibly addressing the root cause of aging itself. Bioidentical hormones. This term can be confusing. FDA-approved hormones are exactly like the ones your body makes and are proven safe. But custom-mixed compounded hormones are not approved by the FDA. Their safety and correct dose are not guaranteed. Always choose care that is backed by solid evidence. Menopause is much more than just a medical journey. It's deeply personal, shaping how we experience closeness and connection in our lives. When hormones change, it can affect desire, comfort during intimacy, and emotional bonding. These changes are normal, but they do not mean the end of a happy or fulfilling intimate life. Honest, open conversations with your partner can make a world of difference. Share what you are going through, physically and emotionally. Together, you can find new ways to nurture closeness and joy through touch, laughter, and simply being there for each other. If intimacy feels difficult, remember, you are not alone. Moisturizers, lubricants, and medical treatments are available and can help. But above all, always remember, your worth and attractiveness are not decided by age or symptoms. Emotional well-being and connection grow with understanding and support. If you need guidance, reach out to your doctor or a counselor, and do not hesitate to talk with your friends. Sometimes, just knowing you are not alone is the most empowering thing. Menopause is a new chapter in your relationships as well. Honesty, compassion, and self-love can create even deeper bonds than before. Menopause is your body's invitation to embrace a new level of health. It's a journey from the old you to the empowered you, the you who listens to her body, nourishes it with intention, and moves with strength and grace. Share this knowledge with your mothers, sisters, friends, and partners. Let's change the conversation together. Menopause doesn't pause for your career or your ambitions. It's a reality for women leaders and professionals everywhere. Across the world, millions of women navigate menopause at work, balancing leadership, teamwork, and personal well-being. Tiredness, mind fog, hot flushes. Symptoms don't wait for your meeting schedule. Yet, silence and stigma can make things even tougher, no matter where you are. But remember, you are not alone. Practical support, understanding, and speaking up can make a world of difference. Start by knowing your rights at work. More companies worldwide are recognizing menopause as a workplace health matter, offering support and understanding. Flexible timings, wellness rooms, menopause leave. If your workplace doesn't have these policies, consider starting the conversation. Standing up for yourself is powerful. Keep track of your symptoms, share your needs with HR, or talk to a trusted manager. Small changes at work can help you do your best. Cooler workspaces, extra breaks, work from home options. Colleagues and managers, your support matters a lot. Listen with an open mind. Learn more about menopause. Push for policies that include everyone. Remember, open conversations break the taboo. Share helpful resources. Workplace helplines, menopause support groups, expert webinars. Menopause is a normal, powerful phase of life. With the right support, every woman can keep leading and shining, no matter where in the world she is. Thank you for watching. Please subscribe for more helpful videos.